Hey, 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 Fit Mama. Jen Oliver here, your host of the Fit Mama podcast. This is the work in to your workout. Hey, Fit Mama. I am bringing you this week our first pelvic floor physiotherapist to the podcast. Everyone who has listened before or who knows me knows that I am a huge proponent of pelvic floor physio. And Marianne Ryan is an outstanding one out of New York City. She is someone who was introduced to me through a friend, and I have gotten to know her online. She has written the international best-selling book, Baby Bod, and she trains new moms and moms of all ages to get their sexy back, heal their deep inner core, much like I am always encouraging you, Fit Mamas, to do. Marianne Ryan is your woman. She is interviewed all over the place online, and she has been a physical therapist for over 30 years. She works with all kinds of incredible clients, and she has a wealth of knowledge with regards to the pelvic floor. Today, we talk specifically about something that is bugging me with regards to incontinence. And just talking to her on this podcast, I implemented it. And let me tell you, my situation has sort of eased its way and is not really there anymore. And that's just from her suggesting it for a minute. So going to see a pelvic floor physio has so many benefits, and you will hear lots of them today with Marianne. Without further ado, here she comes. Hey, Fit Mama, and welcome today. I am so excited to be live here with the one and only Marianne Ryan, pelvic health physiotherapist from New York City. And she is a brilliant woman with so much knowledge, so much experience. And as I mentioned before, her TEDx talk is now over 111,000 views at the time of this recording. So it's pretty exciting to jump right in here. Hey, Marianne, thanks for being here.
I'm delighted to be here. Thank you for inviting me.
Oh, I'm so excited to talk to you. You are the first pelvic floor physio on the Fit Mama podcast. Welcome. Yay. Now, the one thing that I recommend to every single woman who is pregnant or has had a child is to go see a pelvic floor physiotherapist. And the thing I hear the most is, what is that? I've never heard of it before.
Okay.
Have you heard that? Is everybody like, what is it? What do you do? I've never heard that.
Yeah, and people, in order to become a pelvic floor physio, or in the United States, we say physical therapist,
okay,
you have to take a lot of postgraduate seminars, extra seminars, and study it. And even I'm in Manhattan. I had the luck that there's a lot of other therapists or pelvic floor therapists. We had a study group for over 10 years that was terrific, of other therapists.
Wow.
And we work with women who have problems in the pelvis. Now, that doesn't mean you don't have a back problem. It doesn't mean you don't have maybe a hip problem, but it focuses on the pelvis as a whole, and pelvic floor muscles. And a lot of women are embarrassed to talk about some of the problems that they can have with pelvic floor muscles, such as a leaky bladder or even pelvic pain and sexual pain.
Yeah. And do you think it's because people don't talk about it so much that it is sort of still unknown?
I think so. And I think there's still a level of people being embarrassed. It's changed, though, in the past 10 years. Thank God.
Yes.
People are becoming more and more aware. When I first started writing my book, Baby Bod, it was about 8 years ago, and not that many people were focused on the pelvis, nor were they really aware of the problems that pregnant and postpartum women can have, and that there's treatment for it.
Now, is that astounding to you? Because it's 2019 right now. That means 10 years ago, 2009, and we didn't really know about pelvic floor? Like, tell me about that.
I think part of it is women tend to, one, maybe be shy about their pelvis, two, accepting of dysfunctions. A lot of women who are mothers think, well, part of being a mother while I'm pregnant or even after is having some aches and pains, and, maybe things just don't feel right down there. And the sad thing is that statistically, what was it? Something like 18% of women after childbirth have back pain for the first year. And then a year and a half later, they did another survey where 24% of the women who've given birth within a year and a half complained of painful sex. Now, I don't think I would live with that.
Wow. No, it's not something to live with. And that's the big thing, is that we don't talk about it enough, and people live with pain they don't need to live with.
Exactly.
Yes. Exactly. So let's jump in right now to talk a little bit about, what someone might be feeling. I mean, like I said, I recommend it across the board to everybody to see a pelvic floor physio, but what symptoms might someone be having that is like, okay, go now versus sometime in the later future? What kind of things do you see come in?
Across the board, I like that idea, because in other, like a lot of European countries, women go for pelvic floor physical therapy immediately after birth, starting at about 6 weeks.
Yeah, covered by their insurance and recommended even.
Yeah. And France actually started a program in 1987. They started to increase the birth rate because it went up below 2, but they were, I think, the forerunners in the,
they are, yes. So if someone comes in, and they're having symptoms of pain, what is a full assessment look like? Just to give them a heads up, because I'm always telling people that they're going to do an internal exam, and, I want to warn them so they're expecting that. Do you always do internal exams?
It depends. Some women, are a little hesitant, and I can evaluate at least from the outside.
Yep.
And sometimes that works, but really, what's more important is a full orthopedic exam, not just, having somebody assess, well, they're weak, in the pelvic floor region.
Right. And what does that look like? Actually looking at gait and other things?
You need gait analysis for sure, but even, you need a therapist who's going to look at you from head to toe, kind of figure out why you have pain, where it's coming from. And a lot of times it's because the pelvis becomes kind of twisted or torqued. I call it pelvic obliquity, where some muscles are tight on one side, some muscles are loose on the other, and it kind of needs to be rebalanced. So it's a full evaluation, and orthopedic evaluation, and also a neurological evaluation to see if there's any nerve impingements, and an assessment on, how the woman's feeling about things. It's pretty involved. Yeah.
Wow. That is, that's so helpful. And, I think one of the first things that has become sort of more popular in social media and in general, people talking about around core dysfunction is diastasis recti. Can you talk a little bit about that for us?
Yeah. Most women, when they're pregnant, the connective tissue, which is kind of like the skin, that's in between the two six-pack muscles, stretches. And that's to accommodate the growing uterus with the baby growing and stretching out the stomach muscles.
Yeah.
And the hormones that are produced while you're pregnant helps to loosen things up, connective tissue and ligaments and things like that.
Right.
A study was done a while ago. People think that it's even more prevalent, that 66% of women right after birth have a diastasis recti. That's how I pronounced it.
Yeah.
And a month after birth or 6 weeks after birth, a third of them had it.
Wow.
So I think it's more prevalent than that.
I think so too. Yeah.
And what happens though, this other studies showed that 18 months later, still a third of women had diastasis recti. Now, does that mean the same women, the same 30% a month later who had diastasis are the same women 18 months later? I don't think so. Is that it can develop after birth. Reason for that is it takes a while for the hormones to rebalance, the hormones that loosen things up. So a mom is sent home, she becomes sleep deprived, she's exhausted from giving birth, and then she's expected to take care of this baby around the clock, miss out on sleep, and she needs to learn that she's got to protect her body a bit.
It's, it's such an important message, and yet it's still so common to just go hard, right? The minute you get home and lifting and bending and climbing the stairs. And, I'm wondering, what is it that, it's going to take to help us to really understand that this time is so precious and that we can actually hurt ourselves after birth?
I think more awareness, but the medical professionals, the midwives, and the doctors, the OBs, need to warn women, and they need to become more aware of, one, diastasis recti, how it can evolve or develop after childbirth, or if they have it, have women go for physical therapy or physio to help build it, rebuild the strength, and also to teach them what's even more important, how to not stress the tummy, how to avoid things that will also make it worse.
Yes. Okay. That's such a great one. And one of the things that I have up on my YouTube channel is something that I call the side lying safe move, which is essentially, it's every time you lie down and sit up out of bed or, off the couch or whatever, you're almost doing like almost a sit up, right? Which puts a lot of pressure on the pelvic floor and pushes it downwards. So this idea of sort of modifying things, do you have a lot of modifications that you teach women?
I teach them, and I also have a whole chapter on how to modify your behavior, not so that you're not stressing.
That's tummy. So good.
So we call that a log roll, and I teach it to women while they're pregnant. So they lie on their back, they bend their knees, and they try to roll to the side. So they try to roll both their shoulders and knees and pelvis all at the same time.
Yes.
Okay, so when you do a sit-up, what happens is that the pressure inside the belly pushes down, or it kind of squeezes, if you think of it, the organs downward towards the pelvic floor. So that'll further weaken the pelvic floor muscles. And, that's why a lot of women are advised not to do sit-ups right after childbirth, that they've got to build up to it.
Yeah. Okay, great. That, that's really good advice, and just a good awareness piece. Now, I spoke to someone just yesterday who has an 11-year-old and said that she just feels like her core is not functional. She doesn't know if she has a diastasis, but she just feels not supported by her core. What would you say to that, Marianne?
That's very common.
Yeah.
I always say, once postpartum, you're always postpartum. And a lot of my patients are coming in. Some of them are in their 50s where their core is not activated, and it hasn't been activated since they were pregnant.
Yeah. So talk to us for a second. What happens when you're pregnant that deactivates the core? Please help us understand that a little bit.
Okay, the core, if you think of the core, everybody thinks it's just very specific muscles, but just think of the core as very thin muscle fibers that surround the organs and sits at the base of the pelvis. And it surrounds the organs and helps to support. It's almost like a balloon-shaped, shaped thing. And so the core muscles get stretched out because the baby grows and it stretches out the muscles. And when a muscle's stretched out, it becomes weak.
And I think that hormone surge that happens has a huge role to play, doesn't it? Yeah. So
while you're pregnant, in order to accommodate the baby, which we mentioned earlier, everything stretches out, say, in the core, and all muscles are kind of held together. The fibers are held together by something called connective tissue, which becomes looser so that the body can spread to accommodate the baby, and also the pelvis can spread to be able to pass the baby through the birthing canal. Okay, so right after birth, I've seen studies where it might take 3 months for the hormones to rebalance so that your connective tissue system can become more supportive again.
Okay.
There are no studies with lactating women. I did a survey of about 30 physios and international physios and also physical therapists in a LinkedIn group I used to run. And we all found that, yes, there is definitely connective tissue softness or looseness during the time that mothers breastfeed. And that can last for a couple of months after breastfeeding.
Okay.
So that my warning is while you're lactating and for a couple of months after you lactate, assume that your connective tissue system is not working at par.
Yeah.
Okay, so that you're more likely to have a diastasis, 1. 2, you're more likely to develop a diastasis if you're not careful with your body mechanics.
Okay, really, really, really important. Now, this leads me into my next thought is, we feel this sort of looseness, if you will, of our whole body in terms of, that relaxin hormone and all the other hormones that are going on. Now, one of the things that I found, and I did this myself when I had my little ones, and it caused me huge issues in terms of misalignment of my pelvis, a lot of impingement, was sort of standing on one leg and holding my baby on the other hip. Have you seen that a lot?
Yes.
Yes. And doesn't it really, because when the relaxin is there and you have this baby and the baby's growing and you're standing there, you're cooking, you're this, you're holding the baby. I mean, my kids are now 6 and 7 and I still want to pick them up and hold them on my hip. And it's like this desire.
I still have a dysfunction from it. It's very hard to change.
It is.
If you see a typical physical therapist, they'll tell you, well, hold the baby in front. It's really hard to do that.
Yeah, unless you have a baby carrier strapped on, that is not comfortable. And you can't use both hands.
Yeah, and if you have a front baby carrier, as the baby grows, in order to stand up against gravity, you have to go back into what I call pregnancy posture.
Totally, yes.
Bending backwards, and that totally deactivates the core muscles, overstretches them, and your body tells it, you don't need to work.
Interesting. So are you not a huge fan of baby carriers on the front, or?
I just tell people what I used to do, and I did try it a few times outdoors, and I found that it was really uncomfortable unless I was kind of holding the baby with my arms.
Yeah.
I felt like my back and the back of my pelvis was hurting. So what I did is I actually got a back carrier. And once the baby was old enough, now there's more precautions. I used it earlier than they would have recommended these days. But it was like a trekking or a hiking back carrier.
Oh, right. Yes.
Frame. It was the best thing I ever did.
I see those when I go hiking and I think, why didn't I have one of those? They look so fun.
Yeah, it was perfect because even coming home from work, my little one would be, a toddler saying, uppy, uppy, meaning she wanted to come up. And meanwhile, I had to cook and I had to eat, So I would just put her in the back carrier. She was perfectly happy. And I'd actually sit on the edge of a chair and she'd be in back of me. And, go on with whatever chores I had. And, she was just happy to be with her mama.
Oh, I love that. That's so cute. So, sorry, continue.
It's easier to balance the weight that way if you're properly fitted for it too.
Yes. Okay. And that's really what we're wanting to avoid is just extra strain on the body when it's in that vulnerable state, right?
Yes. And when you have a screaming toddler and who else knows what else going on in the household, it's really hard to be protective of your own body.
Yeah. You just do whatever you need to do.
Exactly.
Yeah. Yeah. So if things were in an ideal situation and, we know about what not to do in terms of sitting up or putting more pressure on the pelvic floor or being really too strenuous with our activity or carrying, a heavy baby in a front carrier before we're ready and those kinds of things, what should we do? And I don't love that word because it kind of is a little bit demanding, but what would be ideal that we would begin with, or where do we start?
Well, think of the belly as a canister. Okay. And or even as a tire.
Okay.
Not a flat tire, but a tire with air in it.
Okay.
And if you fill that tire up with more air, it's going to expand.
Yeah.
Okay. And throw things off.
Right.
So what I try to tell people, and I actually show them when I either see them, I see people through telehealth, and I also, on the internet, and I also see them in my office, is that you want to exhale upon exertion.
Yes.
And when you exhale, the core muscles naturally should contract.
Right.
Okay. Along with that, you need good alignment also, but that's another discussion.
Yeah.
So how much should you exhale if you're picking up a newborn baby? Just a little.
Right.
right? If you're lifting a big pot of pasta and you're ready to drain it, your arms are, stretched out. So that's called the lever arm. So that puts even more pressure on your tummy.
Okay.
And when you go to pick it up to drain it, you need to exhale even more.
Okay. So it's all about the exhale in the moment of the movement.
And not holding breath.
Okay. What happens when we hold our breath, Marianne?
That increases the pressure in the belly. So it's just kind of like the sit-ups that we were discussing.
Yeah.
It increases the pressure in the belly, and then it'll push
downward.
Belly muscles outwards.
Right.
And the organs downward.
Yes.
That's when you're more likely to leak some pee. That's when you're more likely to really stretch out that diastasis even further.
Okay. Super important. Now, you just mentioned leaking. I mean, this is something that's so common. It's just like, oh, well, that's normal, right? Which we know when we know that it's not normal, it is just very common. So if someone is feeling this, incontinence, that they're leaking when they're jumping or walking upstairs and stuff, what does someone do in that case other than come see you?
Well, first of all, realize that there's a fault in the system that's supporting the bladder. It might be common, but it's not normal to live with leakage.
Right.
It means that there's something wrong.
Okay.
So people come to me and we kind of change what they're doing, maybe biomechanically, meaning better body mechanics, like we were talking about the back carrier versus the front carrier, exhaling. And, they have to do things like work on their alignment. People call it posture. I call it alignment because I think of alignment as something that the way you carry your body through movement, not just standing still.
Right.
And so it's working on things like that. I'm not a huge fan of telling people go do your Kegels. I think they're mostly a waste of time. I do use them along with breathing and the right alignment and the right breathing pattern as an awareness exercise. And then once they understand how to do it, I don't have them focus on it. Okay. What they focus on is alignment and also the exhaling to match their exertion.
Okay, really good. And I think you said something there that really kind of hit home was the right breathing. And I think that's a huge piece is that, like you said, people are doing Kegels, but all they're doing is just squeezing at a stoplight because someone told them to do that and they're not really doing it right. And therefore it's probably just not helping, right?
It's not functional to sit there and squeeze your bottom. And it's also a lot of women need to first relax those muscles prior to strengthening them. So, muscles shorten when they're in spasm. And when I gave birth, my muscles were tight afterwards because it was a shock to the system. It was very painful. It was wonderful, but it was very painful. Yeah. And for quite a while, I definitely was, I needed to learn how to relax my muscles and then strengthen them. But doing Kegels is not, in my book, a strengthening exercise. It's just to become aware.
Awareness. Yeah. I like that you kind of differentiate that because that's really, really not talked about in that way. And that is such an important differentiation to actually know that if, and a lot of people don't have that feeling of awareness in their pelvic floor, whether it was due to trauma or pain or even just lack of body awareness. Am I right?
Yeah. There are times, by the way, that you can use a Kegel type of contraction that if you're having like some bladder leakage and stuff like that, when I just had a mom last night who is a physical therapist, and she said, I started having leakage again because she's been doing great. Yeah. And noticed it when she was picking her baby up off the floor and also getting up from a chair. So I said, just do a quick flick of the pelvic floor muscles, not a long, strong contraction. Okay. More of a quick flick as you get up. If you, or as you pick the baby up, I just threw a medicine ball on the floor and I said, let's practice. So instead of squatting down, I showed her how to first go down on a knee. So there's different body mechanics that you can use to kind of change those things. I didn't want to come across that like you never use Kegels, but there's ways that you can use it.
Okay, good one. Now, a lot of things shift inside our core area when we're pregnant, obviously, to accommodate baby growing, etc. Talk to us a little bit about what happens after. I know the hormones, are there for a long time, especially if you are nursing, etc. But how do those actually shift back into place, and do they go back or do they go somewhere else?
I don't know where else they would go.
Like, I just know that I've spoken to a lot of women, and I myself feel this, is that like things shifted and they're just now shifted. You know what I mean? Like, I don't know if that's bladder. Like I remember is one of the things that I really found, and I don't think I actually asked my physio about this, but it is something I'm curious about. So I'm just going to ask for my own self, is like, I can pee, wipe, and then stand up, and I could pee some more.
Okay. All right. So let's get back to that question about the peeing. Let's talk about the core first.
Okay.
The core muscles don't go away.
Sorry, not the muscles. I'm meaning more the organs, like the bladder. Does it shift? Does it move? Does it go back, or does it stay somewhere else?
Right after birth, I like to think of it as kind of like the bladder does not function as well as it did prior to getting pregnant.
Okay.
It doesn't mean it has to last forever. So what you have is called incomplete voiding. A lot of women develop that because they push their urine out and they develop muscle tightness in the. Okay, so pushing the urine out is like one of the worst things you can do. I had stress incontinence for over 20 years because I got in the habit when my kids, especially, were toddlers, and I wasn't allowed to go to the bathroom alone. And you have a toddler who's starting to open up opening up the cabinets and pulling out the drawers.
Yeah, you got to go.
And I just pushed that stuff out. And so that was after delivery that I developed these problems. Also, along with that, I realized like 20 years later, I've done biofeedback, I've done all these different things, and I still had the incontinence. I was actually treating people for incontinence. And I sat down, I thought about it, and then I said, you know what, I have to sit down. I was still in the running position when my kids were in college.
Wow.
So I stopped that, and it really resolved a lot of the urine leakage. So what you have, it's incomplete voiding.
Okay.
And so what people like you need to do is right after peeing, rock your pelvis forward and back and do a few circles and go up and down, and then sit down and let the bladder do its work and empty out your bladder, empty out your urine. Don't push it. So you might have the habit of pushing it out. Yeah,
that's quite possible. I agree with you about the toddlers running around and pushing and running after that.
Right?
Yeah.
No, don't touch that. No.
Exactly. You're like, something's going to be on fire or something soon, so we got to go. Yeah. Okay. That's really good. So pushing out, that's a good one, because I'm sure other people can probably agree that they have done that and can notice that. So that's not due to, due to the shifting of the organs. It's more due to a tightness in the pelvic floor.
Probably. The pushing actually can cause tightness, which can cause the leakage. Right. So people think tight pelvic floor. Why would you leak? Because it should tighten. But tighten around the urethra where the urine comes out of. But a tight muscle actually tests weak.
Oh, so I love that.
That's where that comes in. Now, you might be asking about pelvic organ prolapse. Some people,
yes, let's talk about that.
Hormones and also the pressure from the downward pressure from the baby develop pelvic organ prolapse.
Yes, and you talk about this in your TED Talk. And I really appreciate that because, it's something that is the least talked about of all the pelvic floor dysfunctions. Would you agree?
Yes.
Yeah.
I think it's becoming more and more, people are becoming more aware of it, but a lot.
So tell us what a prolapse is, just briefly here.
So just imagine the bladder, rectum, uterus are all being kind of, held up or by some ligaments.
Right. They're sort of suspending there
Suspending. Suspension is a good word for it. There's a lot of other stuff going on, but just think of like two ligaments, suspending the bladder, the uterus, and the rectum.
Okay.
They become loose. So that suspension is lost, right? Doesn't mean things are going to fall out, but they'll migrate downwards. So then with the trauma of the added weight from the baby, that might stretch out the ligaments. And ligaments do you remember like getting like a 6-pack of soda, and there was that terrible plastic that held the 6 cans together?
Oh, yes. I think they've banned that now, because what if it's doing to the water?
I never see them, thank God.
Animals,
but just imagine, did you ever stretch it apart?
Yes, I totally know.
So it kind of stretches, and then there is some recoil, but not back to normal.
Yeah.
And sometimes that can happen with women where the ligaments become really overstretched. And so if you think of it that way, their core muscles actually attach to these ligaments.
Okay.
So the theory about core strengthening or core activation, then strengthening, is activate the core muscles so that they start to pull the organs back upwards.
Right.
There are problems that can occur with that. There can be long-term pain. There can be also incontinence, both from the bladder and also from the rectum. And there is treatment for it. Is it something that can develop after delivery? Yes. And I talk in my TEDx talk, I talk about that one patient I called Meghan, who was very athletic. She was a triathlon, person and or athlete. And she went to the doctor, got the 6-week checkup, and the doctor said, okay, you can go back to all your pre-pregnancy activities.
Of course.
So she lived in Brooklyn, which is a really cool part of, New York City.
Mm-hmm.
And she lived in a third floor or fourth floor walk-up, I forget which. And so she went back to her regular exercise routine. And by the third day, she was feeling pretty good. She was doing things, like some running. She was doing some cardio, some weightlifting. Then she also went food shopping. She had 2 big bags of groceries that she was bringing home. She went up the steps, and at the top of the flight of stairs, she felt something wet, and her entire, she lost her whole, her urine, and her pants got soaking wet, and she felt something as if it was like a golf ball inside her panties. And she looked at a mirror, and she saw that, something was protruding out of her vagina, which she was hysterical about. So she went to her doctor. He sent her to me. We did some treatment. She was nursing her baby, so she was given some estrogen cream to help replace some of the estrogen that would help things down there kind of function better.
Great.
And at the end of the day, she did well because she went for treatment as soon as possible. But she did cause this because nobody warned her, you got to go after these things slowly. And we were talking about these people who are like 10, 20 years later. Why do they still have the problem, even though they're doing their Pilates, they're doing the bar class, they're doing, all of these things that are geared towards pelvic floor strengthening. The problem is that they haven't learned how to, quote unquote, activate the core muscles. They have to wake them up by relearning the right alignment and also breathing behavior.
Okay, amazing. Yeah. So there's different grades of prolapse. So someone might not have something protruding, but they just might feel what?
They might feel like a fullness. Sometimes they might have vaginal farts.
Okay.
Which is very embarrassing for women because things are kind of soft.
Now that is common, and I've heard a lot of people talk about that, in terms of doing yoga or different postures. Like I'll go up for a headstand and then I'll make these noises. And I've actually talked to a few women recently who were telling me these stories. And they said, like, I was in class and I was going to do this move. And then I know this specific move always gives me this basically vaginal fart sound. And they were so embarrassed. So they said they don't do that anymore. Tell me about what that is.
What that is the movement of the organs that are normally supported and in place, that you're moving into a position that is pressing, that is causing probably pressure in your belly to press downward. So
should I recommend that person to go to a pelvic floor physio and they might have a grade of a prolapse?
Yeah, well, I think a lot of people have, different grades of prolapse. They're just not diagnosed.
Yeah.
But the first thing I would tell that person, especially if you're training them, is back down on what you're doing.
Right. And
then build up to it again.
Right.
And, some people are frustrated with my program because it's like very basic, but it's all about form and using, I have people count out loud while they're learning the basics of the program so that they're exhaling as they're exercising. Right. So somebody like that, I would have her just wipe away what she's doing. Let's build up to that again. Go through the Baby Bod program, which is all based on science and also clinical trials that, my patients are doing great with. And it doesn't matter if it's 10 years or even 10 days after childbirth, you can start it.
Awesome.
So I'd have people back up, activate the core properly, work on their alignment and breathing patterns, and then going back to building up to doing something like you're saying headstands. You might want to, are you doing them with your head on the floor, or are you doing them with just your arms straight out?
Oh, this wasn't me. This was just someone telling me about this, that, a friend of mine or something, someone I was talking to in a group. So I'm not sure, but now I will go back to her, and I can think of 2 people who have told me that recently. So I will go back and tell them, suggest to them to back off, because that is such a good point. I mean, we think, we're, years postpartum. I know these 2 particular women I'm thinking of are both at least 5 or so years postpartum. And so if they're feeling that, then it's definitely,
And one way to reduce it is to have them do it near a wall, and maybe just have their knees on their, on their arms.
Okay.
That's kind of squat position.
Yes. Okay.
Strong in that position, get in and out of it several times, and maybe then start to lift up, with after practicing the other, the easier position. And if they're even in the easier position, hearing the queefing, which I believe it's called, or quaffing or queefing, and that they, even back down from that.
Okay, good. I'm glad you brought that up, because that was literally a question I had, and I didn't even know who to ask. So brilliant. I'm so grateful that we brought that up. Now, something you mentioned before to me that I'd really like to bring up on this podcast is the statistic that the U.S. has the highest maternal death rate. Can you talk to that a little bit? That shocks me as a developed country.
Yeah, maternal death or maternal age is considered the day you get pregnant to a year after.
Okay.
And the United States has the highest maternal death rate in any developed country.
So within the first year, essentially. Within the pregnancy during
pregnancy. So that's good, and unfortunately, the women who are most affected are the minority women of color usually.
And why is that, Marianne?
Because they don't have as good health care. They just don't, or it's not as available.
And what are they dying of?
Things like bleed. Some women can have a bleeding, a bleed out, we call it.
Right.
And some of the hospitals are not fully prepared to take care of it. And, it might necessitate, they use like a balloon that they, fill up with air, they put it inside the vagina, and they fill up a balloon with air, and it presses on what's bleeding and gets it to stop. There's just not that great care. I had a patient 2 weeks ago who was telling me, I gave birth and I had to use a catheter, and I was like, why? It was a vaginal birth. She said, well, with my first one, I had severe pain after birth. I was in my room, and I kept on, calling the nurses. My husband was calling the nurses. They kept on giving me medication, and this was going on for hours. So her husband was smart. He called this woman's sister, who happened to be a doctor. And the woman's sister, almost flipped out on the phone. She was in California, we're in New York, So she said, do me a favor, get right to the front desk of the nurse's station and just throw a fit, throw things around and say, you need a doctor immediately. Because they said, well, the doctor will come. So they immediately did a sonogram, and they found out her bladder wasn't emptying, and she was maybe 20 minutes from it exploding.
Oh my God.
So that, and I think it's shortages on nurses and stuff. Then there's not enough care for women once they go home.
I know.
I don't know what they do in Canada, but in, England and other countries in Europe, midwives go and visit the moms at their homes.
Yes, they do here, thankfully, too. But it's still the percentage of people that use a midwife versus an OB is so reduced. I mean...
Don't use an OB, you don't have the midwifery visits?
We do have that. So how it works here anyway, where I'm in Ontario in Canada, you can choose. You choose either the OB route or the midwife route. And so I chose the midwife route, and that was the almost number one reason, was then they come to your house after. And I thought, well, why wouldn't I do that? It didn't make any sense to think anything otherwise.
Yeah, what doesn't make sense is that if you go the doctor route, you should still have the midwife visiting you. You know what I mean? They still need visiting nurses to go to these women's homes to help them out, to do a full event. You know, they need psychologists or social workers to go and do psychology workup.
Evaluations.
Here in New York, we don't have enough lactation support. There, there's a lot of times there's a lot of confusion in a hospital where they might have different lactation consultants see the same patient and tell different information. And women really need somebody to go home with them, sit with them for several hours, at least 2 hours, and then another visit while they're nursing the baby to give them tips to weigh the baby, to see if the baby's getting milk. We don't have that support.
No, and that's where doulas come in, and I can't say enough positive accolades about my doulas that I had. I mean, I'm such a fan. It's such a brilliant thing, and it's so underused. It's like, oh, I don't have money for that. Oh, that's not, not a worthy expense. And I'm thinking, okay, it's the most worthy expense. What do you say to that?
A lot of the problems is, is not necessarily covered by insurance. Lactation consultants are, but in order for them to go to people's home, they have to, here in New York, they charge $200 to $300 for an hour, for a good one who knows what they're doing. And, so it becomes costly. Sometimes the insurance pays, sometimes they don't.
Right.
Some insurances here in the in at least the New York area, you have to use their providers. So there's like one or two provider who might not be the best person for you. It might not be the best match. You're kind of stuck using them.
Yeah.
And the other thing is that, it happens during pregnancy and after. When women are in pain, they should go to a physical therapist or a physiotherapist for treatment, period.
Yeah.
Pregnant women here in the United States are told by the doctor, well, try a hot bath or a hot towel or, moist heat. Try to go for a massage. Try to go do Pilates. And it's like, why not send them to a medical professional who is an expert and let them have treatment,
I know. I mean, where's the disconnect between the doctors referring, like the OB or whomever, instead of saying at 6 weeks, hey, go out and run a marathon or triathlon if that's your thing, where is that doctor not saying, go see the PT?
I think even like a midwife, I'll tell you a story. People like to spend patients' money for them or like to judge. All right. So I had a midwife who I needed to get a referral from. In New York, physical therapists need doctors or midwifery referrals for physical therapy.
Oh, see here, we don't need referrals. So
so we don't need it for the first month. And then after that, and as far as midwifery goes, I'm more qualified for schooling, it drives me crazy, but whatever. So I was talking to this midwife because I was seeing one of her patients who was in pain, and I was doing birth preparatory stuff with her also.
Yeah.
And I said, the patient wants to come for more, than the 30 days, so you'll need to write a, prescription. So she had this long conversation with me, didn't understand it. She said, well, you're the only therapist I know doing this. You must make a lot of money. And I was like, you just don't understand how it's needed. I was very insulted by that remark, and I thought it was unfair. But, that's what happens. And like, give people options. Right. And if they want to, afford to get out of pain, maybe it's 1 or 2 visits and you feel great afterwards. Why shouldn't a woman feel better?
Absolutely. But is it that the doctors just don't know that the pelvic PTs exist, or else what would be their reasoning for not saying, hey, 6 weeks, good, everything looks good, but it's time to reignite your core. It's time to become aware. It's time to know how to lift. It's time to, how can we, like that disconnect, it literally keeps me up at night. It's just like, I am cringing and I don't know what to do.
It's not that they're not aware. They're becoming more and more aware. People are like hitting them over the head. Physical therapists are hitting them over the head with the information. It's just not normal for them to do it.
Right. Right.
So it's just
hopefully
not normal
that's
for
changing.
a woman to get good postpartum care that they deserve and should have.
Yeah.
And not be sent home, with a tiny little human being while they're not even fully recovered.
That's
it gets me mad. I think about, when I had to get my license to drive a car, 1, I had to take a written exam, and 2, physically be able, and I had to prove and take a test to physically prove that I could drive the car.
Right.
Well, I think sending a human being home with somebody who's totally clueless. I had this one patient who was literally starving her kid the first month, and her kid lost weight because her mother kept on saying, well, let the baby cry. They're supposed to cry. He was crying because he was hungry, and she just felt devastated when she, found out from the pediatrician that she was underfeeding him. And she thought she had a colicky baby. All she had was a hungry baby, so people need help.
Yeah, you're right. And I'm just glad we're having these conversations to create more awareness, because it is just so, so needed. And, I just, it just pains me to think that any person goes through that, without knowing when this information is out there and those people are out there and available. And it's just, it's really, I know you feel the same way. So, anyways, well, you know what? I'd love to just conclude our chat today, Marianne, with, I know you had recently done a interview on Fox News about the princess herself across the pond, who is having a baby soon, Meghan Markle, and she's of course all over the news. Yeah, one of those famous preggo people. And you were talking about how she can prepare for birth. So maybe you could share some of those tips with us for our audience, for the pregnant fit mamas, or anybody who knows anybody who's going to be pregnant. That's the best time, is before or during pregnancy, to start to learn about this stuff, right?
Exactly. It was exciting because to have a physical therapist interviewed for the birthing prep is very unusual.
Good.
So the first point I brought up is have a birthing plan and discuss it with your midwife or doctor. Also, we talked about the best positions to give birth in, which in the United States, I don't know what they do in Canada, the most common position is lying on the back, like a frog position with legs. And that's the worst position because you're not gravity assisted. And it also, with your legs up and out, actually closes down the size of the bony architecture.
Yes, okay. Thank you for saying that.
Yeah, so more internal rotation. So the better positions would be like on all fours. I didn't have a midwife. That's the position I delivered in. I don't know about you, Jen.
I delivered on all fours for my first. Yep.
Right.
It was one of those things where I remember laboring on my back, and I think I was about to go into pushing phase, and I said, I have to flip over. And it was one of those things where it was just intuitive, and there was nothing that was going to stop me in that moment.
Exactly. That's great. So that's one of the best positions. Also, a modified squat. When you normally squat, most women tuck their tailbone in.
Yeah.
That also will close down the outlet, the bony outlet of the pelvis. So leaning over on a ball or on your partner in a semi-squatting position could be good.
Okay.
Some women do well with side lying also.
Oh, I've heard that. Yes.
So those are some positions. Also, what a doctor who's an obstetrician who has a whole campaign going on in Europe said that many doctors tell their patients to push when it's way too early. You got to let the woman labor. I know that for me, once it came time to push, I really didn't have to push because I used to say, it felt like I had the dry heaves in the opposite direction.
Yeah.
My uterus was expelling the baby.
Exactly. Yes, I had that too. And I remember I actually was laboring at home, and for my first, I wanted to give birth in the hospital, and I was at home, and looking back, I'm like, I could have had the baby at home because I had this natural urge to push. And then I ended up having to take a 20-minute drive to the hospital, feeling that, and then getting to the hospital, and she says, you're 10 centimeters, you can push. And I'm thinking, I could have done this an hour ago because I was ready, and so was she. Yeah.
So you could have had a baby, you could have been on the news and, and named your kid like
Car.
Yellow Line or Highway.
Yeah, exactly. Okay, great tips. So birthing positions, birth plan. I always talk about a birth plan too, because I honestly, before I spoke to my doula, I remember meeting her, I think I was about 6 months pregnant, and saying, I read all the baby books, and then I stop anywhere close to anything talking about labor and delivery because it scares the bejesus out of me. I don't even want to think about it. So what do I have to know? And then she's started explaining to me, what an epidural was, what an episiotomy was, what these things were. And I was going, oh my God, I had no idea that was even a possibility. So had I not known any of this before, that this could have been something, obviously things don't work out exactly as planned. That is, no questions asked. But just to have a bit of awareness in creating the birth plan, I think is the power, not even trying to carry it out, right?
Yeah. And then the other thing, it was interesting, I taught a couple of workshops in China last spring, and I taught them the Baby Bod program and certified some of the practitioners, and it was kind of fun. It was a lot of fun.
Yeah.
But this woman who was normally athletic, she was about 5 months pregnant, was in the class, and she said that, my doctor said I'm not allowed to exercise, because I was talking about pregnant women and how studies show that women who exercise moderately, one, have a healthier pregnancy.
Yeah.
But about 6 months ago or so, they did a study where they found women who exercise moderately most days of the week have faster and less complicated deliveries.
Mm-hmm. And she was told not to exercise?
Just like moderate exercise. So it can be walking, moderate exercise I consider something that you do and you can have a conversation.
Okay, right.
So it doesn't have to be even like, they didn't do any, specifics on what type of exercise, that would be another study.
Yeah.
And then there was another study that showed that women who exercise moderately throughout their pregnancy actually have smarter babies.
Oh, that would make sense in some ways, just due to oxygen and circulation and things like that.
Exactly. Yeah, there's more collateral circulation actually going to the brain or something like that. But I thought that was really kind of interesting.
Yeah. So this woman who was 5 months pregnant was told by her doctor not to exercise?
In China, yes.
Okay, interesting.
We went to lunch and I told her, go exercise. And I came back, she said, I feel so much better.
Oh, excellent.
Just imagine being a trainer and also used to exercising every day of your life, and then suddenly you can't.
I can't imagine. And I exercising during my pregnancies literally was my favorite thing. And my sister actually still laughs at me she came to visit me when my second was due. And she had her own little one at that time. So my little one would be sleeping. She was staying at my house. Her little one would wake up early. She'd be playing with him. And I'd be like, hey, I'm off to the gym, 6 a.m. And I'd take a popsicle and I'd go off to the gym. And she would laugh at me. She's like, you were so huge. You were still going for it. And I just loved it. It was literally my favorite part of the day was exercising pregnant.
Yeah, which is great, because it got you out of the house and you didn't have to be with your kid. Your kid was also healthy.
It's such a nice reprieve. And that's the way I see exercise now too. And I know a lot of women, once they have a baby, they just want to get back to sort of that intense exercise that gave them almost that mental health benefit. But non-intense exercise can give you so many mental health benefits too. So it's just about reworking the perspective on things.
Or doing intense things when you're supported on a bike.
Yes, there you go. Great one.
Yeah. About standing up and down when you're doing spin classes, but starting out that way.
Good one.
Fast walking is intensive exercise when you first deliver.
Definitely. Yes. Okay. Well, Marianne, we could talk for hours, I think about this. So. Yeah. This has been so valuable. I know the FitMamas are going to get so much out of this, and hopefully everyone is calling their local pelvic floor physiotherapist to get an appointment ASAP. I've trained women up into their 70s and early 80s who are having incontinence and other issues related. So it's never too late. And I'm glad you pointed out once you're postpartum, you're always postpartum. And also you pointed out that if it's dysfunctional after birth or at any time after that, it doesn't have to be permanent.
Right, exactly.
Yeah. So
if I can just plug a little bit.
Please.
My book is out there to help any moms.
Yes, Baby Bod. I love that name.
Yes, and also we're going to be coming out with an online program, and hopefully it'll be ready this summer, because most of the moms I met, even in my office or at baby fairs and trade shows and stuff, said, make it into a video, please.
I know.
So I wasn't doing it. It just took forever to do, but I'm focusing on it, and I'm really excited that the films are coming out beautiful.
Oh, yay. So, well, I will definitely share that when the time comes, or else if when this is released, it's available, we'll include that in the show notes. So thank you, Marianne. And we're going to include all the links for people to find you and be able to potentially work with you virtually as well, which is great. So yeah, thank you for this very, very valuable info and your time, Marianne.
Great to talk with you, Jen.
Same
and
thing,
fun
likewise.
doing what you're doing.
Oh, thank you. I so appreciate
Supporting the mama.
you. Yes. Have a great day. Have a great day, Fit Mama. Talk to you soon. Namaste. Hey, Fit Mama. That was my episode with Marianne. How informative was that? We touched on a ton of different things. As you heard, my incontinence issue, and I'm sure that there are many different varieties of incontinence issues, grades of prolapse, different levels and types of back pain or other deep core injuries that I know you may be having and I know can be remedied through the use of pelvic floor physiotherapy. So I highly encourage you, if you're in the New York City area, you go see Marianne Ryan. She is awesome and so knowledgeable. If not, I have so many recommendations of other pelvic floor physios. There are incredible ones available to you, and they are in your city, Fit Mama. So send me a message. I will help do a search with you. We will find you one, and we will get your deep core going in the right direction. No pain. I know it is possible for you. Thank you again to Marianne. Thank you for you, Fit Mama, being here. And I am so grateful to bring you this episode of the Fit Mama podcast, the work in to your workout. Have a good week, Fit Mama. See you next week.